Welcome to the Hakam Inspire podcast.
With us today, we have Dr. Jalil Sharif, who is a psychiatrist specialising in neurodevelopmental disorders, intellectual disability, and autism and ADHD. He has a postgraduate qualification in neuroscience at King's College London and is currently completing an MSc in genomic medicine at Imperial College London. Dr. Jalil, Assalamu alaikum, peace be upon you, and welcome to the podcast.
Wa alaikum assalam, peace be upon you too, and you can just call me Jalil.
Jalil, thank you for joining us. So, mashallah, you've had an amazing journey so far in research, and we want to get into what you've been researching, especially as well. So, just tell us right now, in terms of your background, how you got into the research, how you got into psychiatry as well, and what kind of things are you researching?
Okay, sure. So, I guess in regards to my professional background, in regards to psychiatry, I guess from when I was when I was much younger, I guess in schoolish time or so, I always found the mind very fascinating, and at the same time, I found genetics very interesting. And after my degree in medicine, I started working and did my house jobs and so on and so forth, and I landed in psychiatry, and I never looked back. Within psychiatry, I was exposed to this specific specialty that I'm doing right now, which is in intellectual disability, neurodevelopmental disorders, and also encompassing autism and ADHD. And that I found very fascinating, and it also caused me to be more interested in academia because it's a very nice area where there's an overlap between genetics and neurodevelopmental disorders. Because most of those most of the patients that I see do have an overlap. They have some sort of mental health problem, they have a genetic problem, and they do not have the IQ of a normal person, and then they also possibly have autism and ADHD as well.
Sure. So you've done a lot of research into IQ and understanding sort of what IQ is. Can you share with our listeners what you found? What is IQ? And, some people disregard it as a score, as a predicting score. Some people take it quite seriously. So give us a bit of information about that.
So IQ is essentially it's a psychometric test to measure someone's aptitude, or meaning someone's skill. And there are different types of IQ tests, but essentially what that means is it's testing your ability to do certain things, including the most common and the most famous IQ test is called the Wechsler Adult Intelligence Scale for adults, meaning for people over the age of 18. And for children, it's called Wechsler Intelligence Scale for children. And that aims to measure different things, different skills. So the two main categories that are there is either testing your verbal IQ, and that includes vocabulary and maths and things like that. But it also has a specific part on performance, and that would be things like spatial awareness, meaning if you would have a puzzle of how to put the puzzle together, or also looking at symbols and match patterns and so on. So there's two major elements to it, and that gives you a rough guidelines of what the level of functioning is for that person.
And is that, very nicely described, but you have those online IQ tests. I remember as a kid, I used to always take it, and it used to be those things where everyone would be discussing it in school about have you taken that IQ test online? How accurate are those, and is that the way to test the IQ? So how would you go around testing?
So I would say if you really want to know about your own IQ, I would say you should get actually a proper one done. In the internet one, I think I've done them myself as well. I'm not too sure if they're too accurate.
What is a proper one?
So as I mentioned just now, the Wechsler adult one, Wechsler adult, it's called WAIS. That would be a proper one, and for children it would be something called WISC, WISC. And they would be the most common one used by psychologists and psychiatrists to assess someone's level of IQ. And the average person who doesn't have any problem with the intellectual functioning would have the IQ of about 100. So that's the rough average. Yeah.
100. And is that at a particular age, or what age are we talking about? 100.
So I think that needs to be clarified. So generally speaking, the IQ is consistent from birth until adulthood, unless you would have some sort of trauma to your brain. So what that means is you usually keep your amount, but unless something happened to your brain, you can only reduce it, but you cannot actually increase the IQ that you have.
In terms of upbringing, so you do a lot of work with children and their development, and especially with children who have low IQ. How much does upbringing, child development affect, especially in the early stages, affect IQ? There's a lot of other studies where there's, the child attachment theories and how that affects relationships in the future. But so I wanted to ask that how much does upbringing affect IQ within children?
So I think that's a very good question. Although my major work is actually with adults, but I'm definitely very well aware in regards to how it comes about from the childhood and goes into the adulthood. So we usually say that about 80% of your IQ is predetermined by your genetics. So that will give you the estimate of how much you will have as a child and all the way into adulthood. The 20% that's left remaining is what you're rightly asking, things in regards to your upbringing and your social environment and so on. Generally speaking, from a psychiatric perspective, we don't look at just one perspective. We look at it from the biological, psychological, and social model. And I imagine the question is there any way for us to allow a child to develop, either be more intelligent, and I think that would be a more, or be able to work much better with new information. I think that's a more appropriate question, because IQ, as I said, is generally very fixed. The maximum you could probably be the maximum wiggle room you would have is maybe about 5. So instead of having 100, you might be able to get to 105, but you wouldn't be able to get from, let's say, 60 to 100. So that there's a fine line and fine difference there.
Sure. I mean, you've mentioned genetics there, and you mentioned kind of how that has an impact on your IQ. So, is there any actual way to kind of develop? You said, sort of broadly speaking, is consistent throughout your life. Is there actually any way to develop, or are you sort of always going to, for someone with low IQ, are they always going to be like that? And is there any way to maximize your capacity? So, a person who has the ability to reach a potential IQ, they actually create that kind of environment around them. What kind of tools and things can they use?
So with the intellectual disability side, so generally the patients I see would have an IQ less than 75 mostly, and from our understanding, usually that has been consistent from the early parts of their life up until adulthood and continues. So they usually had some assessment in school. They would have some assessment while we have seen them as adults as well, and this would continue to progress. And generally, there's no change in the IQ, but there would be a change in how we support them and how they can actually develop life skills and how to approach, um, how to improve their daily functioning. Now, if it is somebody who has a normal IQ, a child who has the IQ of 100 or 100 plus, it is more important to discuss about matters, to provide a nourishing environment, to allow them to develop skills, to be more efficient at learning, to be more curious, and then to develop skills that will allow them to be the best of what they want to be the best in, essentially, if that makes sense.
If we just bring in sort of ADHD and autism here, we've talked about sort of intellectual disability. These conditions in particular, how is IQ sort of relevant in these conditions?
So generally speaking, the way the amount or the frequency of ADHD and autism, we call the specific term for that is used as prevalence. And what we usually mean is in about 1 to 2 people per 100, there is autism as well as ADHD. We generally use a different diagnostic criteria for that, which is called ICD-10 and also now the ICD-11. And generally speaking, the American system, meaning USA and Canada, so on, they will usually generally use a different system. So they have usually a higher rate of prevalence, but the consistency worldwide is about 1 to 2 children in 100. Now, the more relevant bit is ADHD and autism more prevalent than general population or with somebody with intellectual disability? So the consensus is, because if there's some abnormality in the brain either during both birth or after birth, then there's more likely risk for somebody with intellectual disability to have autism or ADHD. But that does not mean that people in the general population cannot have that. So there's there's sufficient amount of children, if you think about 1 in 100, 2 in 100. That's a lot of children who would also have autism and ADHD.
You know, one thing just coming off that, it's so you have all these labels, you know, that they've got autism, they've got ADHD, they've got intellectual learning issues. How much, you know, I'm sure there's a lot of parents out there and people who, well, grown-ups who, you know, realize that they've got ADHD or they've been told they have. From what I've read, there's a lot of people who've gone on to be very successful. They've got autism, they've got ADHD. For example, Michael Phelps, you know, he's famously known as having ADHD, and Einstein, they say that he had autism, and a lot of these, it's anecdotal, but they say in Silicon Valley a lot of people have autism. So for all those listening who are worried if their children or themselves they have this, how does that actually affect life?
I think that's a very good and very relevant question. I would say it is individual circumstances and individual environment that allows you to have essentially a relative successful life of what other people would perceive as successful life. I think we have to consider the fact that having a diagnosis of ADHD or autism is a bit like having a nationality. So let's say we are all of South Asian background. We all are Pakistani. So diagnosing somebody with autism is essentially he is in the country of autism. Every person with autism will have shared characteristics, but every person who's got a diagnosis of autism is also unique in their own way of how they have autism. So if you have met somebody who's got autism, you have met one person with autism, and his autism will be different than the next person's autism.
Yeah, that's an interesting point there, actually, because it's all sort of relative. It's all sort of in the sense that no two of these conditions are the same. So it's interesting to see kind of how the overlap is in terms of IQ here. Just want to touch on this aspect of neuroplasticity. You know, this kind of understanding that the brain can change and develop and rewire throughout life. Does that have an effect on IQ? And if so, then again, is this something that is it deeply related, or how deep does it correlate with the intelligence of an individual?
I think it goes more so to the aspect of actually learning and learning efficiently. So because your IQ allows to a certain degree of how you can learn and how you can learn effectively. And then the environment provides you the tool of how to learn further. So the neuroplasticity is the bit of when you learn, you can develop new skills, but that is all limited by the overall IQ that you have, if that makes sense. So it's a stepping stone. If you have a normal IQ, you will be able to gather more information and you will be able to develop more skills in life. And to nourish that, you have to think about actually living a healthy lifestyle. So, eating healthy, doing exercise, and actually learning itself is a good way of being successful in life. So, being actively engaged in the pursuits that you're interested in and wanting to have that curiosity. So that is all a positive stepping stone towards staying intelligent and continuing with that, with continuing your engagement with activities that will continue to allow you to be more intelligent. But the actual underlying IQ won't change. And with somebody who's got a lower IQ, it will be difficult for them to learn the same amount as somebody who has got a normal IQ. And that's what makes it more challenging, and that's what made me interested in my profession in regards to how can we support people with low IQ and how can they learn to develop normal living skills. So I find it very interesting. So for us, it's not pretty normal to make a cup of tea, to brush your teeth. And then that comes normally for us because this is something we learned early on. But when I see some of my patients, they struggle with these things. And how do we provide them effective support so they can learn that? And that goes back to the level of IQ. So your IQ allows you to be more effective in learning, to develop a wide variety of skills. And that possibly is something that other people then perceive as he's very intelligent, he's outstanding. But that does not equate necessarily to IQ, if that makes sense.
Yeah, yeah, sure. So I want to ask you. You spoke about exercise. You spoke about having a good diet. You spoke about learning as well. What other steps, and if you could expand on these steps as well, and what other steps, if someone wants to improve their learning or their child's learning, what other steps could they take? If a lot of people have issues with focus at work, kids with ADHD have focus issues. So what steps could people take? You spoke about exercise, diet, and mind or learning new things because that helps with plasticity. But if you could expand on that and give, what protocols and tools you would recommend to people in helping with this.
Sure. I think it's not actually rocket science. We don't have to go really out of our way to reinvent the wheel, essentially. The most basic things is, if we have to go back to the basics. So what can a parent do to provide an appropriate environment that facilitates learning? So this is mainly things like attention, being supportive, being a supportive parent, providing them with sufficient stimuli. So stimuli means things like maybe puzzle solving maths problem, giving them a Lego set or things like that. And at the same time, we also need to encourage them specifically physical activity, because physical activity is very highly correlated with developing new memories, being able to retain these new memories, and that essentially is positive for learning. If we have, or if we just live a sedentary lifestyle, we won't be able to learn as much because we're not. Evidence has shown that there's definitely a positive impact of learning because of physical evidence. And then after the physical exercise, we also have to think about our daily routine, including our sleep, and that is very important as well to develop new memories and improve learning as well. Yeah, but not more than 8 hours. So not 12 or 16 hours of sleep.
Right. You want to tell that to the teenagers. Why is sleep so important?
So sleep is very important for a couple of reasons. So usually when we go to sleep, it allows our brain to get rid of the toxins, and it also allows us to actually go through our dream state as well. There are different phases to sleep, and essentially some of the phases in the sleep that we have allows us to develop new memories. So that is also sleep. That is why sleep is so important to us as well.
If we touch on sort of the Islamic aspect as well, so one thing in particular I want to ask is that quite often what we find is those individuals who memorize the text of the Holy Quran, so they memorize the Holy Quran. It's said that those individuals, the Quran, learning the Quran opens the mind and opens the brain. So sort of want to touch on this aspect. Is there any scientific evidence that this could actually happen? In other words, is being a hafiz or learning part of the Quran, is there any evidence that would actually increase your intelligence or your brain function or even affect your neuroplasticity?
So I would say I have not looked for any specific evidence, scientific evidence. I think it would be very limited for Western researchers to look at any specific to tackle that question on a scientific basis. But I think it goes back to what I was saying earlier, that learning something new, and then definitely learning the Quran, that's something that's dear to you, and being interested in it, then it allows you to also have that personal relationship with the Quran as well, because you're not just learning something off by heart, you're also using your mind to, once you have a certain amount of knowledge, you also are able to understand that bit, and that will allow you to have a way of thinking of how to think about one verse, how to think about other verse, and so on and so forth. So it allows you to know the factual bit, but it also allows you to to utilize that bit in argument, for example, of how this verse would fit in this specific argument, or so on and so forth, or in this discussion. So using it in an appropriate way, because the way if we come to the question, let's say, how is Albert Einstein a genius, or how is Mozart a genius, or how is Dr. Abdul Salam a genius? The way I see it is, you have acquired a fundamental level of knowledge, and you have become so well versed in that fundamental of knowledge, you're able to develop new ideas with the fundamental knowledge that is accessible to everyone. So that makes the difference between someone who is, in my opinion, a genius. They have a basic level of knowledge that would be accessible to anyone, but they're able to go around and go about, to develop new hypotheses, to develop new ideas from the basic understanding that everybody else has same access to.
Right. And just basically continuing with that question, are there any other overlaps you've seen in your research when you've been, all these years? Any connection with Islamic teachings that, there's like a eureka moment that, oh yeah, that's a kind of which, Islam already teaches kind of thing. Did you get any of those? Have you found any connections?
I think I tried to find a Quranic verse, and I've still been struggling to find for it. But I think essentially it was in relation to DNA, and that essentially it is very difficult to put down DNA if we wanted to write it out as a book. I don't remember exactly which verse that is, but I hope it sounds familiar. Essentially, the more we look at DNA, the more there are questions that we have answers for it. We cannot explain everything. And there's not just the DNA bit, then there's the aspect of translation. So that is the RNA. Then there's the bits about proteins. And then there's the bits of how the cell looks and cell interacts with other things. So there's just not just one thing to it, there's 5 or 6 different layers to it. And we are just at the beginning of it and we don't understand it fully. So it's from the perspective, from the Islamic perspective, it is that we should strive to learn this new wisdom, but it will be still very difficult for us to do so, because this is creation. We were created by God, and we won't be fully able to understand what God's creation is all about.
Just another question: how much inspiration do you get from the Quran when you're reading it? Because there's a lot in there about creation, about humans, about psychology, psychiatry, all these kind of things. Do you get inspiration from the Quran?
Yes, definitely. So I think some of there's a couple of facets to how I get inspired by the Quran. So one of the most interesting that I found very interesting, I think, I always found the virgin birth. I found very interesting, and the genetic side of things of that. The other things I found interesting is specifically when the Quran talks about people who have got illness and disability, because if they don't have the capacity to make decisions in regards to how they will be treated by God and what rights they have and how they should exercise living Islamically. So, for example, if you've got somebody who's disabled, they don't have to exercise the same rights as they're not required to go for the pilgrimage. They're not required to do certain things that is compulsory for people who have a normal intellect. So I found that very fascinating. In regards to other questions, and I think there's more ethical questions in regards to where we live in the current times, because more and more research is done on genes, and you might have heard about, I mean, it's quite common to hear about these, like things like designer babies and so on, and there's a so Islamically, I think it's something we should have more awareness about, to have a position in regards to what is our stance on these things. So I think I definitely find that the Quranic teaching, from my understanding, provides a clear-cut answer.
Just as a final point before we close off, other youngsters who may be listening to this, who aren't so sure what they want to do in life, I want you to sell to them why they should go into research, especially whatever research that is.
I think that's again a very good question. So if you would have asked me, after medical school, will I do another degree afterwards, I would have probably would have said no. But I've done plenty of exams afterwards, and once I felt into academia, once I started doing for postgraduate education, I haven't looked back. I've thoroughly enjoyed it. It allowed me to grow as a person. It allows me to understand things better, and I think that's the main thing in regards to, we as Muslims, we are supposed to travel all the way to China if we have to seek knowledge. So I think, and gaining that knowledge will allow you to be more successful in life. It will allow you to stand apart. It will allow you to consider where you want to take your next step. If you finish your education too early, you're limiting your options in life. And if you are continuing with education, you will have more avenues open to you. And the more avenues that are open to you, the more options, again, it goes back, the more avenues you have, the more opportunities you will get. It's actually a feedback loop, and I think that's what I felt is my experience in life as well. The more I have done, the more opportunities came about.
Fantastic. And Dr. Jalil Ahmed Sharif, Jazakallah, thank you very much for joining us on the podcast. It's been a pleasure. Had some really interesting discussions, and we wish you the best in the future, inshallah.
Thank you for listening to the Al-Hakam Inspire podcast. We hope you enjoyed it. Visit our socials on Instagram, Twitter, and YouTube at Al-Hakam Inspire. And of course, subscribe to our YouTube channel and leave your comments there. We would love to hear your feedback and thoughts, so send us an email to inspire@alhakam.org.